So I'm Dr. Lorelli Nowell. I'm an assistant professor in the Faculty of Nursing at the University of Calgary, and I also hold a teaching and learning research professorship, and I am the PI on the study.
Hi, I'm Michele Jacobsen. I'm a professor in the Workland School of Education and a teaching scholar at the University of Calgary. A lot of my research focuses on graduate supervision, peer mentoring in graduate programs, and teaching and learning in blended and online learning environments.
Hi, my name is Diane Lorenzetti. I'm a librarian with Libraries and Cultural Resources, and I also have an adjunct appointment with the Cumming School of Medicine. Like Michele, I also have a deep interest in peer mentorship and professional growth in general. And both of those interests sort of seem to very well dovetail with this team's interests as well.
Hello, I'm Elizabeth Oddone Paolucci, and I'm an associate professor in the departments of Community Health Sciences as well as the Department of Surgery. And my background is psychology. I have a PhD in human development and learning. And like my team members here, looking at professional competencies, peer mentorship, and wellness overall in learners and faculty is an area of research interest to me.
Hello, my name is Liza Lorenzetti, and I'm an assistant professor with the Faculty of Social Work. I'm also the coordinator of our clinical Master of Social Work program, and I am passionate about transformative learning and relational learning, so I'm excited to be part of this team.
Our team, as you can tell, is all a group of caring professionals. So we come from education, medicine, social work, and nursing. And we've done a lot of work together as a high-functioning multidisciplinary research team on topics that are meaningful across our disciplines and research interests, including mentorship and professional learning and development. And I see the similarity in our disciplines in that we're all focused on meeting the health, educational, and social needs of society rather than its material needs. So we're often in close face-to-face contact with the people that we serve and that we help care for and teach in society. And with the onset of COVID-19, our team really saw this urgent need for caring professionals to develop some of these digital skills and competencies that are required now to care for society remotely. So we came together to look at how we could best look at online learning opportunities for our students so that they can develop the skills to be high functioning in today's digital economy or digital world that we're now living in. So we know that we can work well as a team. And when this call came out from SSHRC and the Future Skills Center to look at skills and work in the digital economy, I couldn't think of a better group of people that could help answer some of these important questions. Probably all agree that our team's diverse disciplinary perspectives is our team's greatest strength. So when we work together before, we can really see things through different lenses when we come together. And these collaborations have really helped expand our professional networks and identify these opportunities for interdisciplinary and transdisciplinary research, such as this project.
I would say that the openness that the team has demonstrated has really allowed all of us to learn. You don't see the type of disciplinary rigidity that you might see in other teams, and that's been such a benefit to our group because it's allowed us to start using shared language, approaches, learning from each other's strengths. I myself have benefited tremendously from being part of the team.
What I really value about this team is that it's really opened my eyes to new perspectives and new ways of knowing. And interacting with this team has really inspired other research and other work that I've done outside of the team as well as within. So I see multiple values in being associated with this group.
I think one of the big values is that we can bring these different perspectives, maybe even different approaches to some of the same research methodologies, and really leverage and integrate those understandings to create something new and to create something of value to all four disciplines of study. We've studied our process as well, and we've all learned that we have a lot more in common in our research approaches as individuals coming from caring professions than we do differences. However, we don't avoid those differences. We talk about them and we think about, well, how can that add? We've also been able to work across different layers of expertise or different years of experience. And each member of the team is valued for what they bring, the ideas that they bring, and everyone has a voice on what we do as a team.
Because we're on an interdisciplinary team, I think we have a confidence that we can make novel contributions and provide some meaningful impacts by trying to solve complex challenges that I think in each of our respective disciplines we face. And part of the process involves, of course, knowing our respective fields really well. But each of us are, we're trained to have deep areas of specialism. And so once we started our dialogue and started comparing what we know within our disciplines and then looked at things across our disciplines, we noticed, I think, relatively quickly the common ground as well as the gaps that became apparent. And having this expertise wasn't enough. So working on interdisciplinary team has really highlighted the importance of us finding a common language for our communications. And then the respect that we've developed for each other as scholars and experts. So that's inspired a really safe place where we can be open-minded and willing to share even sometimes unpopular ideas and then stimulate change. And I think therein lies that path toward the creation of a potential solution to, some of these wicked problems that we're wanting to address in our research.
Yeah, I've also observed us mentoring one another. And so using some of our individual expertise to enhance the capacity of everyone on the team. And so that's been really lovely to see.
I agree, Diane. I think one of the other things that's been really valuable for me on this team is the inclusion of students from different disciplines as well. So taking a student's perspective from some of our research has been really valuable. And I think what a great opportunity for these students to participate on an interdisciplinary team and learn from those different disciplinary lenses. I think it's one of the big strengths of what we've done together.
I would suggest another key strength of our team is that all of us are leaders and all of us are also good at being followers and trusting each other as far as, trusting that the ideas that someone is bringing forward are really helpful. But we also have to read a lot to keep up with each other. So we keep pushing each other to know more, to learn more, to become aware of more literatures. And each of us likes that challenge. So, we share power, we share, responsibilities on the team. And we also keep looking for more opportunities to work together. So we actually really like working with each other, which I think is really a powerful part of what makes us work.
Yeah, that's an excellent point. I think, I've learned that working collaboratively means embracing different ways of working together as well with people. Everyone has their own strengths, their own ways of structuring how to engage in a process that for many purposes is clearly defined. We have to go through certain steps, but the way we engage in that process may be different and we can support each other even through those differences. And often what I found is that things that I find as a weakness or an area for improvement for myself, you guys have stepped in to show the strengths that you carry, and that brings us forward as a team and advancing the work that we're doing.
Yeah, I think that's helped us avoid a lot of the tensions that might arise in other teams, just because we are open and willing to listen, and there are no egos at the table, which is also very nice and helpful.
I can concur because I was a fairly new assistant professor when I joined the team with a lot of you amazing women with more experience. And everyone was so welcoming. And also, it was really a power sharing space. And also the mentorship, as was mentioned previously. I've learned a lot, and I've also been recognized for what I can offer the team. And I think that that's been really wonderful. So you come in feeling good, you come in feeling positive, and because there's that positivity and reception, you're willing to grow, take chances, lead. We've all had the opportunity to lead on this team at different times. And that also shows in the way that we're presenting our work. So you will see different ones among us leading different presentations in our various disciplines in transdisciplinary spaces. And we're always encouraging one another. Yeah, that sounds great. Go ahead. I'm going to join in. And there's a lot of trust among us to really, I would say, try new things and sort of meet new horizons.
That's a great point. And I just to build off of that, Lisa, also our productivity as a team has been so much greater than if, I would have had to do this work on my own. If we look at some of the traditional metrics of publications and presentations alone, as you said, we've been able to target various audiences and that has, I think, helped share and disseminate the information that we're generating, the knowledge that we're gaining from this work, and hopefully that means that it also will reaching a broader audience, be more impactful as well. And so sharing that burden of work and productivity has been another valuable, consequence of us working together.
Definitely, we've been able to come up with deeper and more interesting research findings by drawing upon all 4 disciplines of study. So our work really does kind of transcend any one of those disciplines. So when we were, studying, peer mentoring together, we really drew upon some of the strengths of the research in all four of the disciplines, as well as taking seriously the issues that were similar, the issues that were different. And with the current project, we're doing the same. We've worked really carefully together to think about our, selection criteria for which studies to include. And that's been a very collegial, process where we've really thought about each and every word, each and every decision that we're making about what to include in the knowledge synthesis from the 4 disciplines. And that's all done collectively. So each of us is really taking away from that a deeper understanding of the issues collectively, but as well a new lens to bring back to our own discipline.
I think that's a really important point, Michele. And I think the idea that we're taking this transdisciplinary approach to our research is really going to have impacts across the disciplines, because quite often, I'll speak from nursing's perspective, when we're thinking about how are we going to teach this online, we look into our own discipline to find those answers. And with this project, we're looking outside of our disciplines to be able to answer those common questions that are happening across the caring professions at the moment. So I think that idea of looking outside as well as inside and then collaboratively is really one of the strengths and what we're going to be able to provide insights into with this research.
Yeah, I completely agree. The fact that we're all experiencing a very similar problem right now, and although our target populations are different, our audience, our clients, whether they're patients, they're our learners, we're all experiencing this challenge, and the pandemic has highlighted that for us. And so we want to be responsive, we want to be flexible, we want to be able to learn from each other so that we can not only impact curriculum, which I think across the university and hopefully broader than that, our more local community will be impacted, but hopefully we can also look to have some national, international impact with our findings. But also us working together hopefully will serve as a model that is becoming far more popular and also necessary. In order to do this kind of work, we need to collaborate and not just say that we're coming together, but as we've described, break down some of the barriers, some of the language and some of the silos that naturally occur, especially within a large institution like a university, so that we can use our expertise to try to solve problems that have a real life impact. And I think that's a good example for our learners, because we're encouraging them to develop those professional competencies. And so by us doing this through research, hopefully that will inform educational practice as well.
And that's a real great transition, Elizabeth. I was thinking about, how are we training, the next generation of doctors? How are we training the next generation of nurses? How are we training the next generation of social workers and teachers for the classroom and for higher education? There's so much that our disciplines have really, learned and generated with regards to each of those questions in each of our disciplines, but bringing those understandings together, especially during this current health crisis, is so important to get, those meta understandings. There are some things that we all do incredibly well, and we can share those insights with each other, but there's also some things that we do in similar ways that, we can start, to have a lot of confidence in the theories that we're generating, because we're saying, what, this is happening across disciplinary contexts. It's not just in any one discipline. So it also brings a lot of credibility and explanatory power to our results and to our findings. So it's really timely research. It digs deep into each of our historical disciplines or historical research literatures, but it also transcends them with new understandings and innovative insights.
Yeah, absolutely agree. I think that the work that we're doing is important, and it does sort of transcend disciplines, and I can see applications beyond the disciplines that we are currently associated with. But even beyond that, some of the work that we've done around trying to unpack what goes into effective transdisciplinary teams has been really valuable. And I see that as being an important component of what we can share with our colleagues as well.
I found it fascinating when we had the discussion about what constitutes a caring profession. I thought that was a wonderful conversation among this team and what definitions really worked for all of us. And that expanded my thinking about how the other professions, the sister professions that I was working with, viewed caring. Also, I also found it really interesting that we were able to land on a definition that connected with everyone's professional interests. And then it helped me go back into my own field where we were all struggling with providing clinical supports and services during COVID-19, and being able to make those connections and understand the intersections between what we were trying to do and struggling with and what others were also struggling with.